Welcome to Ask Dr. Tom. We connect with Dr. Tom to talk about all things health and wellness, cancer treatment, etc. This is Ask Dr. Tom with Dr. Thomas Incledon. He's the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making him one of the most sought-after healthcare professionals of our time.
If you test positive for the BRCA1 gene mutation, what are your options if you're a female and you want to prevent the development of triple-negative breast cancer?
So we'll start off with, the standard of care conventional options would be, so you could have a mastectomy, where there's a removal of the breasts. You could have oophorectomy, which is there's a removal of the ovaries. So those would be surgical options that are available to women. Now, some people might say, hey, I'm so worried about getting cancer. I want to just, if I got this gene, I want to just remove these tissues from the body, so likelihood of me developing cancer is much less. Other women may say, you know what, I don't want my body to be disposable, and I don't want to just remove these parts, so casually. I think that surgical stuff, the surgical strategies, that's a conversation each woman has to look at individually and maybe have it with her family and our oncology team. As far as non-surgical options, there are quite a bit. There's all kinds of options available, and so what I would ask women to do is find out what those options are, because it may be a better outcome for them, because the problem with a surgical intervention is that there's no way you can't remove cancer cells in the blood through surgery. So then there may be something left over and you might still develop the cancer anyway. So that may not be a good fit if you think about that. One thing I'll share is that many times women are told part of the story when they go in for surgery. And then after surgery, they're told, okay, now that you're done with surgery, we're going to have you on drugs for life. And so what I would encourage women is, before you do a surgery, like removing double mastectomy or an oophorectomy, is kind of get the whole, like a survey of the whole scene, meaning like, what do I do before, what happens during the surgery, and then what do I have to do after the surgery, so they can make sure they're comfortable with that approach. Because what I've seen is a lot of women saying, I went through this process and now I realize this wasn't what I thought it was going to be. It's very different. And they're kind of, I wouldn't say stuck, but they're kind of locked in a path that they're not comfortable with.
When you mentioned this triple negative breast cancer and we started talking about it, and you shared the information about the BRCA1 gene mutation, I started thinking, this kind of sounds familiar. This was in the headlines a little bit. And if I'm not mistaken, this was the gene that Angelina Jolie was tested for. And I believe she, at least publicly said, I wasn't there with her at the hospital, but said that her decision was to do this double mastectomy in order to prevent it. So are you suggesting that that may not be the best way to go for women?
Yeah, because what happens is, one, it's assuming that you won't get cancer, and you're removing a body part or multiple body parts, if you will, to reduce the risk of cancer. And there could be other factors besides, like if some of those cancer cells have spread to the blood already, then just removing the body parts won't really produce the solution that you're looking for. The other aspect about that is that we know that certain combinations of natural substances enhance the kill rate of chemotherapy against cancer cells, and they're safe, meaning that it minimizes side effects and symptoms that people have afterwards. So if you were to know, hey, I could take a few pills and I'm getting rid of the cancer in my body, and later on it worked, versus, hey, I'm going to remove my breasts and ovaries, and afterwards I still have to take pills. Like, it kind of makes the surgery seem almost unnecessary for some cases. So that's why I suggested, people really talk it through and find out sort of the pros and cons all the way through. Now, if you go into a cancer treatment center that only offers, surgery, radiation, and chemo, well, then that's the only options they're going to make available to you. So then you won't know about other options that are available.
This is the Ask Dr. Tom show. We're talking with Dr. Tom about triple-negative breast cancer and the correlation between the BRCA1 gene mutation and that particular form of cancer, and what you can do to prevent it, what you can do to treat it. Why, Dr. Tom, why is triple-negative breast cancer resistant to common oral medications that other breast cancers respond to normally?
So the reason why certain medications don't work for a woman diagnosed with a triple-negative breast cancer is those medications may be targeted to an estrogen receptor or a progesterone receptor or a HER2 receptor. So if the medication is targeted to something the woman doesn't have, it's unlikely to produce a beneficial result or an outcome. So you can't just throw a drug at someone and hope for the best. There's got to be a strategy and there's got to be a rationale behind it. So when women let's say women that have a triple-negative breast cancer and they can't use, let's say, the traditional medications used for breast cancer, they have lots of options. So for example, there are different types of chemotherapeutics referred to as taxanes. There are various platinum compounds, and there's monoclonal antibodies, and there's different natural substances that could be utilized in conjunction with those substances that appear to improve the outcomes dramatically. And so my point is that women aren't limited as far as what can be done. It just requires a team that's willing to test them, to monitor them, and then figure out if something's working, then keep doing it. And if it's not working, what they will change or transition to make sure that the woman beats that cancer and it's no longer any signs of cancer in her body. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So whereas someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.